There we are. Right, so I'd like to thank and welcome Gemma Henry to talk to us today about the yellow card scheme. And if we have any questions, if we could ask at the end, that'd be great. So I'll pass you over to Gemma. Thank you, Gemma.
Hiya. So as Fionn said, my name's Gemma. I'm currently working as a pharmacist in the Cardiff and Vale Health Board, and I'm speaking today on behalf of the Yellow Card Centre in Wales. So what is the Yellow Card Centre? So the MHRA, who you might have heard of, are the UK government body who are responsible for licensing medication and medical devices and things like that. So they cover all the safety aspects. So then the Yellow Card Centre, which has national areas, but obviously we're in Wales, are funded by the MHRA to promote the understanding, reporting and research of side effects to medications. So what is a side effect to medication then? So side effect is a response to a drug that's unpleasant and unintended. So these can happen if medication is used as planned, as it's stated in the leaflet, or it can also happen if it's used in ways that it potentially shouldn't be. So, overdose, taken more than prescribed. You can have off-license use or off-label use, which is when you're using a medication, for example, that is only licensed in adults, but it's being used in a child, or being used for a condition that it's not licensed for. You could also have abuse and misabuse of medications, so taking things for longer than recommended, or using illegal substances, or taking someone else's medications. You can also have medication errors, so if medication's taken at the wrong dose, the wrong time, or if it's given to the wrong person. And then you can also have occupational, so that's things like if a nurse was crushing a tablet for someone who has trouble swallowing and they accidentally inhale some of the powder, they would all be classed as a side effect. So then what's a yellow card? So it's the name given to the official report of a side effect that someone writes down and sends off to the MHRA. And it's normally now done online or on the app, but historically it was a piece of yellow card that you filled in, and you can still do that. So it's just sort of the name that arose for it. And these reports then from all around the UK go into one big UK-wide database, which means that they can look at the information, analyse it and see what's going on with all the particular medications and things. So with side effects, there's always going to be side effects to every single medication. So even something like penicillin that everyone knows of, it's really commonly used and is, very, very useful in treating infections and things, still has side effects that we know of. So some things are quite common and, generally quite mild. So like rash, nausea, diarrhea. And sometimes people might discuss with their doctor, nurse or pharmacist and decide that actually they would rather change to a different antibiotic if they don't want the side effects. So those are common, happening in 1 to 10 people to 1 in 100 people. You can then have something like kidney damage, which is an uncommon side effect, so affecting 1 in 100 up to 1 in 1,000. So that can happen with certain medications. Then you've got your more severe reactions, so things like skin reactions, anaphylaxis, or colitis, which is a difficulty with the bowel, and that can happen sort of 1 in 1,000 up to 1 in 10,000, so you're getting quite rare at that point. And then you've got your very rare reactions, so things like liver damage that could be anything sort of less than 1 in 10,000, so you really don't see those very often, but it is still a possibility. So in terms of clinical trials then, they don't find all the side effects. So drugs are tended to be done in sort of 1,000 to 3,000 people on average, meaning you'll pick up the common and the uncommon side effects, but the rare and the very rare effects are only going to be picked up after it's gone onto the market when it's in a much larger population. Because you can imagine if you're trialing it in 3,000 people and you've got a side effect that only happens to 1 in 10,000 people, chances are you're not going to see that until a lot more people have had it. So that's where the yellow cards come into play. So then in terms of the yellow cards, they find these rare and very rare side effects because you don't see them in the trials. And also it's important that in trials, people with multiple illnesses are often excluded because it can confuse the study. Whereas as we know in real life, people tend to have more than one condition. So they might have kidney or liver disease, which can also increase their risk of bleeding if they then take blood thinning medication. And you also sort of get things like drug interactions that you might not see in the trials. So if you were taking a different drug and then, so say something like erythromycin, which is an antibiotic, if you were prescribed that and you already take something like a statin for your cholesterol, they can interact and cause muscle damage. Can also see side effects in children. They're generally excluded from trials, and the same in pregnancy for the ethical reasons. So sometimes with children, they'll handle drugs differently because their bodies aren't just small adults. They have slight differences in how they break things down in that. So you might see side effects in them that weren't seen in adults. And the same with pregnancy, you know, it's unethical to trial drugs in pregnancy. So generally you'll only see babies exposed once the drugs are on the market, and mom either needs treatment during pregnancy or takes it when she doesn't realize she's pregnant. And so in terms of something recently, I suppose, is how we've seen the clotting effects with the AstraZeneca COVID vaccine. It wasn't picked up in the clinical trials because it's such a rare number of people it happens in, whereas now that we've given it to a lot of people, we've started to pick that up. So who's most at risk from side effects? So the people listed here are who we would generally say are more at risk. So elderly people, so over 65 if you're going by the categorization, they don't tend to clear drugs as quickly from their system, so that can accumulate more and you get more side effects, which means that some drugs will have a slightly reduced dose or that in elderly people to combat that. Then children, so the very young children are more prone to side effects as well. And as I say, because a lot of drugs aren't trialed, it's just sort of picking these things up. If people have multiple diseases, sort of multiple disease states, they're more likely to have side effects, which is partially due to the fact that they're on more medications, but also because one of their conditions might be affected by drugs being taken to treat a different condition. Females generally have smaller organs of elimination, so like your kidneys and your liver, so they're more likely to have drugs accumulating. And then you might also find that the hormonal states can tend to make women more susceptible to side effects. So an example of that, is that recently in America, there's a sleeping tablet called Zolpidem, and they have now half the recommended dose for a woman compared to a man because they've realized that it's broken down more slowly. You can also have people that are more prone to allergies. So things like asthma and eczema might have a more severe allergic reaction than sort of the general population. Some people may also have genetic predisposition. So if they carry a certain gene, they might be more prone to side effects of particular drugs because of how they're broken down. And then if you're on multiple drugs, so they've shown that the risk of having a side effect goes up with each additional drug you take. So by the time you're on 5 drugs, you've got a 50% chance of having a side effect. And by the time you're on 7 medications, you have an 82% risk of having a side effect. So these are all factors that can lead into that. However, we need to look at the benefit versus the risks. So most drugs are really important in controlling medical conditions for people, you know, like blood pressure, to prevent heart attacks and strokes. So if you've been prescribed a drug, then, you know, you should continue taking them. But if you're having side effects, then it's worth talking to a doctor, nurse, pharmacist, or whoever's looking after you, so that you can help look at the risks and benefits of that and help you decide if, you know, you can live with the side effects or maybe reduce the dose, or is there an alternative that might not have these side effects. So something that maybe some people have experienced is there's a certain class of blood pressure tablets, so things like lisinopril, and a well-known side effect of those is a dry cough, which obviously some people find quite annoying to live with. So there are other blood pressure tablets then that don't cause that side effect, but they are slightly more expensive, which is why we tend to go with the other ones first line, because some people, you know, the majority of people are fine with them, but some people find they get the cough, and so you can switch to something else. So it's just about weighing that up for each individual patient. So in terms of side effects, studies have shown 70% are potentially avoidable. Obviously, we can't predict every single side effect, but we can do some things in way of trying to minimize them. So only using medicines if they're needed and prescribed for you. So if they're prescribed for someone else, you shouldn't be taking them really. And if you're having to buy something regularly from like the chemist or the shop, then you could check that that was okay with the pharmacist or a doctor as to if it interacts with your normal medications, or if it's something that if you're having long term might need to look at. Then certain drugs, they advise they stick to the same brand because they might get different blood levels and either be less effective or more likely to cause side effects if you start swapping between. Generally, it's things like anti-epileptics and that, and you would be specifically told if you should stick to the same brand. So then following the instructions and not taking more than prescribed. And certain drugs will say not to chew, so swallow them whole. And that's because some of them are designed that they'll release the drug slowly as it passes through your system. Whereas if you chew them, it'll release it all at once. And so you're more likely to get the side effects from it. And the same thing with instructions about timing and taking with food, because sometimes if you take them on their own, when they say take with food, you might be more likely to get side effects from that. And with things like timing, so prednisolone, which is a steroid, if it's taken at night, it can cause insomnia because your body naturally would produce more steroids in the mornings. And then also checking for drug interactions before taking something new, which includes herbal and any sort of purchased medication or alcohol. So there's some medications such as anti-epileptics that can interact with some of the herbal products and things. So it's always worth checking with those. So then one that people might have heard of is Vale. So this advertisement that you can see was taken from the British Medical Journal in 1961. And at the time, it was marketed as being safer in accidental overdose than barbiturates so that it could save a child's life if they accidentally took it. But as we all now know, Vale is thalidomide. And it took sort of 10 years after this, almost, I think, before people realized how dangerous it actually was in pregnancy. So people have done literature searches now going back to the 10 years before the thalidomide tragedy and have shown that there was multiple individual letters about these effects published in medical journals all over the world. So the signal was there that actually this was harmful in pregnancy, but it wasn't picked up because there was no sort of overarching body looking at all of this. So this is where the yellow card scheme was then developed from. So it's an overarching body where all the reports can go to so that we can see everything that's going on and hope that we can pick things up quicker or sooner and that it'll help similar tragedies happening in future. So why should you report a side effect then? So it's a really, really important role in patient safety that everyone can add to. So it helps us identify any unrecognized hazards and so act as an early warning system, as I said. It also sort of allows continuous monitoring if they're old and new, because sometimes things just take a while, especially if they are rare, before you would get reports enough to realize that it was an issue. So it helps us sort of evaluate the changes and the risks and benefits. So, some things now we've noticed that actually certain anti-inflammatory medications like ibuprofen and that are more likely to give gastrointestinal side effects than others. They also show with new drugs, because we have a lack of experience on the side effects of those, it helps us to keep gathering information on those when they're put under a wider population of people. And so we can sort of see what comes from that. And it gives us more information as well on being able to optimize medications for certain groups. So it's helped us identify things like if age, race, and disease state makes you more likely to experience certain side effects, or should certain groups potentially not be having those. And again, with a rare side effects, so for a reaction that occurs in 1 in 10,000 people, you need to expose at least 30,000 people to it before you're going to detect that side effect with any sort of level of certainty. So then who can report a side effect? So anyone. So members of the public have been able to report a side effect since 2008. So obviously we're quite away from that now. So you can report a side effect if either you personally are having it, if it was a child of yours or someone you're caring for. Health professionals can also report, and in terms of duplication, the systems are designed to pick up any duplication. So if you were thinking, oh, the doctor maybe said they were going to do it, but you weren't sure, or you wanted to make sure, then it's worth putting one in anyway, because it's better us knowing twice by accident than not knowing at all. So then what should you report? So should you report any suspected side effects? So if you think it's had any effect whatsoever on new drugs, so they tend to have like a black X on the patient leaflet somewhere that looks like that. So even if they're not serious, you should still report them, because it means that the medication is being like really intensively monitored and we want to know everything about it. So it tends to be new drugs for obvious reasons because they're new. Can also be for new combinations of drugs. So sometimes they'll take two existing medications and combine them in one tablet. So because that's then sort of a different, slightly different thing, they want to see if it makes a difference. Can also be new ways of giving a drug. So if something was previously only available as injectable, and now they've come up with a way of giving it as a tablet, because again, it can act slightly differently. And if there's new reasons for prescribing drugs, so recently, so in December, there was a drug called, oh, I've forgotten the name of it now. Anyway, it was one of the anti-diabetic drugs anyway, and it was licensed for use in type 2 diabetes. But as of December, they've now also licensed it for use in heart failure. So because that's now a new way of using it for something different, they'll be keeping an eye on that just to check if there's anything else we should be aware of. So then in terms of all the other medications, so anything that's not black triangle, you can report all serious suspected side effects. So serious meaning that it's enough to interfere with daily activities, or if it's something that isn't already listed in the patient information leaflet that comes with the medication. And the bottom line is that if you're unsure at all, report anyway, because it's better off to have more reports than less, because it gives us a better idea of what's happening. In terms of how can you report, so as I sort of briefly mentioned earlier, there are still paper copies available from a pharmacy or GP that are literally paper copies of the yellow paper that you can write it all into. But probably what's the better way now for most people is you can fill it in online. So you can go on the website, fill in all the details, and it's just, I find it a lot easier. Or there's also an app available, and there is also a hotline as well if that was what someone was interested in using. So with the website, this is what the website looks like. So you can see that it gives you different options for reporting. So you can report, so they have a specific COVID-19 area now that's been added quite recently to try and gather all those into one area. You can have side effects, so that's medicines, vaccines, and herbal or homeopathic products. So it doesn't just have to be sort of conventional medications. We're interested in knowing about any potential medication. And then there is sort of devices and things that are defective or fake medications if that was ever to come up. So it's just, yeah, so that's just circling where the sort of usual place that people would be clicking on. And then when you go through and do that, you can like provide your email address and that if the yellow card wanted to get back in touch to ask more information or things like that, they can do. So how this then improves patient safety. So it leads to changes in the patient information leaflet, things like restrictions of use or special warnings and precautions. So medication people might have heard of is diclofenac, which is an anti-inflammatory medication. And you used to be able to just buy that in the chemist, but they've now changed that to prescription only because they noticed that it can sometimes put people at a greater risk of a heart attack. So they've changed the information leaflet to say that shouldn't use it if you've got a heart condition. And they've, as I say, also have made it so it's prescription only because that just acts as an extra layer of precaution and safety for everyone. And they may also withdraw medication from use entirely if they think that actually it's too much of a risk to patient safety. So an example of that was ketoconazole, which is an antifungal drug, and the oral version of that was taken off the market recently because it could cause liver damage, and we have other available antifungals that are much less likely to have that side effect. So it was decided on balance that it just wasn't worth having out there because there was too much of a risk. So in terms of contact then, so there's Twitter page. So I know the top ones of these are specific to Wales. There's the Twitter, Instagram, Facebook, website. Then those are the email addresses for the regional centres. So I don't sort of have the contact details on here just for space reasons, but they will all have their own sort of social medias and websites if you just gave them a Google. But equally, you know, you could just send them an email if you wanted to get in touch. So yeah, that is all I have. If anyone has any questions they'd like to ask.
Right. Yeah, thank you, Gemma. That was brilliant, full of really useful and interesting information. As Gemma asked, has anybody questions you'd like to ask? Oh, I think Sue, you're on mute.
That's better. Yeah, sorry, I couldn't charge my phone, and I thought I'd taken it out, put it back in again, and so I've got a, you know, like an extra thing. So I'm in the garden, so I couldn't get it charged. And I really wanted to be the first bit, but I missed it. Yeah, I haven't had I haven't had the injection because I've got masses of for 30 odd years I've had masses of side effects from all sorts of drugs. So my GP a year or so ago said, I think the best thing we can do, if we as possible, we won't give you medications unless we actually have to. So I don't have flu shots, I don't know anything like that, because I know I don't know I'll react for certain, but there's a good chance I will. I've chosen not to have COVID because I've never been tested for anaphylaxis, but when I phoned up the anaphylaxis organisation for somebody else, she happened to ask me a specific question, and I said, I think that might apply to me as well. And I've collapsed in the street when I've had something that I shouldn't have eaten. I didn't know even things like foods and things. So I haven't had it, so I'm not going to have it because my sister's a doctor, and she said, well, you can have it in hospital, and then they'd know how to treat it. So I said, the problem is with that, I have low adrenaline or no adrenaline shots in the dentist, so I'm not very good with adrenaline either. So I'm choosing not to have it, and I'm not the only one. Obviously, there's obviously other people that can't take it. But I suppose, and I've actually told other people to put stuff on yellow card because I'm a therapist. So I've told other people, so why would I need to do that? I said, well, perhaps not for you, I said, but other people, because they said, well, I'm not sure I want to fill it in. What does that mean? I said, well, you know, it will help other people because that's really important. It may not affect, because the list now is obviously very long. Side effects people expect to have, but I remember going back years and years and years ago when my mum had something. None of us, I didn't grow up with taking lots of drugs and pills anyway. So I know when my mum had a leaflet once, and I can remember back to those leaflets having not very many side effects. I said, well, there's probably side effects now because people have reported them.
Yeah, that's the thing. You know, it's just the more people report stuff, the better a picture we have, which is obviously, as you say, if not for yourself, then for other people. It's kind of it feeds into the fact it's patient safety for all of us that we only know about things because people have reported them. So it's always worth reporting if you think that it's.
I thought I might be right. I'm having a brain injury as well on top of everything else I've got. People say, well, don't you think you're in a high risk category? So I said, well, I'm not. I do have other conditions, but I don't take anything unless I absolutely need to have acupuncture and things like that. So I can't take. People say, well, what about the risks? And I said, well, I'd probably more risk if I took it than if I didn't. And I quite like living. Do you know what I mean? And friends of mine said, well, don't you think you're more at risk? You're double at risk if you can't have it. And I said, I have to make that decision because my GP said it's your decision. When I didn't want the flu shot last year, he said, well, I said, are you advising me to have it? He said, well, I'm advising you should have it, yeah, but it's up to you if you want to. And he was like on the phone, and I thought, well, it's my decision. So it's my decision, presumed it's my body. So if I having been carted off to hospital more than once because I've collapsed in the street or I've collapsed at a friend's house or I've collapsed somewhere else, I'm not willing to do it. I mean, to me, that's important. I mean, if lots of people say to me, why don't you take it? Wouldn't you be better? And I'm not an anti-vaxxer. I mean, I've got loads of friends who've taken it, obviously, and some who haven't, but I'm certainly not an anti-vaxxer, and I don't post anything anywhere that says anything unless I know that somebody's. I'm not on, I'm not on Facebook at the moment, but I wouldn't do that anyway, because I'm not an anti-vaxxer. People say, well, if you haven't taken it, surely that means and I said, no, I've got a right to what I take, and it's something I've chosen not to have. I thought about it. I thought about it a lot. Should I take it? Should I have it? But because I know because I've already had reactions for about 35 years. I've only had the brain injury for since 2010, but because I've reacted to so many things, I've collapsed in hospital. I've collapsed at the dentist. It's not. I don't think it's worth it.
Yeah, and obviously, it's everyone's personal decision based on their own risks and benefits. So, no one can be forced into having it if they don't want it for their own reasons.
Yeah, I'm not stopping other people. I have other people will ask my opinion, and I said, well, it's it's entirely up to you. Am I, and say, oh, are you having it? So I said, well, no, I've got, and then somebody, oh no, because you're really allergic to stuff. Is that why you're not having it? And I've kind of bypassed that and said, well, actually, that is one of the reasons. What are the other reasons? And I said, well, the personal reasons. I have had 30, and then got onto the subject for 35 years of being. Well, how do you know you'd react? You probably wouldn't, or maybe not. I'm not willing to take that risk. And I think that's it, isn't it? It's about what I'm willing to take.
Yeah, as you say, it's your personal decision as to what medications you receive, and it's important to acknowledge that as well.
And I think it's right, because I know in the past when I've been allergic and the doctors put it down on notes, I suppose really my thing, I should really report all those to the yellow card, because I've never done that. I've known about the yellow card, but because I reported it to the GP I had at the time, and I'm assuming it went on my notes, because half my family were allergic. Well, they're not the ones that are still alive aren't, but the ones that were, and me, we're all allergic to penicillin.
Okay.
And that took 2 years before they put that on my notes, knowing that I said, I'm not taking it. Oh, that's right, you're allergic. But it took 2 years to put it on my in bold letters, and I find it really impossible if I had to go to hospital for anything, and I end up in the A&E, and they say, and I say, what is the point of me filling out a really large triage form if you're going to give me that or call that? I can't take stuff like that. Well, this is what we advise. I said, right, if it's advice, I can't take it. But it's like it's this drug or nothing. And I said, well, I won't take it then. I'll take something else. So I have balms and Ayurvedic stuff, and I've been told, well, they're no more effective than water. So I said, well, that's my system. It works for me. So that's I have to kind of fight my corner, as it were. But it's relentless, because I get asked ridiculous questions. Well, it's on my notes, or I've told you several times, but you don't seem to believe me. I'm not making it. If I could take stuff, I would. And it's very difficult, and I certainly wouldn't advise anybody else. It's up to people's decision. It's their own decision. So I think the yellow card is an excellent system. So I think what I might do is find an old list of what I'm allergic to, and then just fill it out or something. It's a very long list.
Yeah.
I don't know if that would be the right thing to do, because I've got the side effects are odd. They're not all the same.
Well, thanks, Sue. Interesting. What you were saying. Has anybody else got any questions? No. It was interesting when you were talking about penicillin, because I think that's quite a common one that people are allergic to. I think you said, Sue, that you're allergic to penicillin.
Yeah.
I've
been for half my life, really. So.
Yeah, my mum is as well, and the last time she came into contact with us was when I was a baby, and she swelled up and she could hardly see. So it's on all of our notes now for us not to have penicillin if we're going to be in contact with my mum, because she could react. Like, when I say that to the doctors, my GP fully understands, but when you go in and they ask if you're allergic to something, and I'll say, well, actually, my mum's allergic to penicillin, and I can't have it if I'm around her. And some people are kind of like look funny at me and thinking, why? It's not you that's allergic to it, it's your mum. But it's that her reaction is so bad that we live in a farm. Well, my mum I don't live in the family, but my mum does, and even the animals aren't allowed penicillin,
Ah.
just in case she comes into contact with them and
Yeah.
reacts. Yeah.
But I think it's one of those things, like it's important to be aware that even with something like paracetamol, you know, if you do look at the leaflet, there's a whole long list of potential side effects, and it's because people have reported them. And, you know, sometimes it is the case that they are very rare, but, you know, the manufacturers, to cover themselves legally, will have to put them on there. But yeah, it is just those things that unless people do report them, you know, there's no way of knowing really. So it's good in that sense that now we have this system to try and pick those things up instead of them being just randomly reported and taking a lot longer to come about.
Yeah.
But how long's the yellow card been around? Did you say in the 60s?
I think, yeah, I'm pretty sure I don't know that it was necessarily in the same format ever since then, but I'm pretty sure that was when it sort of started, was around then, when after the thalidomide tragedy, that someone went, actually, we need a way of bringing everything together instead of just reporting in random journals and things and hoping somebody will add it all up.
Yeah, and obviously having it in random journals, that the general public won't see those.
No, and that was the other thing as well, is it's now a much more accessible system for anyone.
I know when I had to live with people saying to me, why can't you eat that? Why can't, oh, you're just fussy. I said, actually, I'm not. I used to be able to eat anything I wanted and have anything I wanted. But once I started reacting, I'm not going to take it. Do you know what I mean? It's not, I'm not eat, or you could have this to counteract that. I said, I'm not taking something. I was offered that at hospital once. They said, oh, you could have this. All my other patients have this. And I said, well, I'm sorry. I said, but I'm not prepared to have that just so I can eat whatever I want, because that's just masking the problem. I prefer to go back and find out why I can't eat it or what I can't eat. And then I got into, you know, studying the therapy I do. So it's the thing, isn't it? I mean, you know, quite often whatever you have makes you want to learn more. And I think that's it. And more people these days are much more interested in how things work. They're not used to saying, oh yes, I'll have that 3 times a day. People are, because people say to me, you know, what about if I complain? I said, you're not complaining. You know, you're going to the doctor and say, can I have something else? It's not your right not to do that. That's what I would tell somebody. I mean, you know, it's not, you know, if it doesn't agree with you, you can keep taking it, or you can still keep taking it, or the doctor will give you options.
Yeah, and that is the thing, you know, it's coming much more into the shared decision making now, you know, where I think compared to in the past, patients are much more involved in decisions instead of just sort of, oh, well, this is what I was told to do.
I think also, well, I said they're not mind readers. They won't know. They said, well, wouldn't they know? I said, well, you might see a different doctor. You might not know. You know, you might, or you might have moved county or something. I don't know.
Yeah.
But it's in your interest, because if they don't, and if you are reacting to it, then it's in both your interests, because you don't want to have to take them and then be carted off to hospital or something. I don't know. I just think it's like, and I think that's what a lot of people still think, that, as you say, if you take something and, you know, why can't you carry on taking it? Well, individual, and the system is different. So,
for anyone who missed the beginning of this session, it's been recorded, so it will be put up on Headway UK's YouTube website in the next few days.
brilliant.
So if you visit there and have a look, you should be there in a few days, so you can watch it from the beginning and see Gemma's wonderful presentation. So
yeah, it was really good. It was really well. You know, I think the points on the slides, it's not too many. I mean, you know, you talked about them obviously, but they're not. Sometimes you go to a meeting and everything's it's too much. And, you know, it's like lots of stuff on there, and it's enough. It was just enough to put it on it. So it's really
I should also caveat that I inherited the slides from someone else, and then I've just added some of my own bits of commentary. So I can't take all the credit for the slides.
Yeah, we're very good, very clear. So yeah, it's great. Well, thank you very. If nobody else has got any more questions.
I was just going to say thank you, Fionn, for saying that. I've been struggling to get onto the Zoom since the beginning. So I missed all the good parts, probably. So it's going to be really good to be able to look at it back on the Headway side. Yeah, broadband is just a nightmare today.
Oh, it is, isn't it? I think there's been a little bit of problem with internet and stuff in the past few days. But well, if you want to give me your email addresses, I could always email you the link just in case you miss it. Or unless, you know, we don't want to be checking it every day, YouTube every day. If you give me your email address, I can always email you the link.
I think it'll probably come out. Diane Derbyshire, our area lady, she's really good at sending out. If you missed it, well, here's the link. So I'm sure I'll catch it on some of her.
Oh yes, you'll get it off today. Yeah, great.
Yeah, I got an email about this one, but I remember thinking, oh, and I don't look at my email every day, so then I came up and thought, oh, another one I can't make. Oh, hey, well, no, I can do that one. I can go to So it's a really good time to have it. Thanks.
Yeah, great. Well, thank you very much, Gemma.
No, thank you very much for having me, and I hope it was helpful and enjoyable.
Yeah, really enjoyed it. Yeah, thank you very much. Okay, nice to see everyone.
Nice to see you all. Thank you very much.
Okay, thanks for joining us.
Thank you. Now.
Bye.
Bye.
Bye.